Hey guys, Dr. Kyle Lovelace here. Hey, I want to talk to you today about some symptoms, some things that a lot of people are dealing with. As far as the most common thing some of the most common things that come into our clinic that we've been able to help people with the most. And this is things like migraine headaches or just regular headaches, neck pain, and then also carpal tunnel syndrome. So I'm going to talk about those things. I'm going to tell you how they relate, how they're very close together on how they're affecting the body. And then I'm also going to give you some ideas of what might be causing your headaches or your neck pain or your carpal tunnel syndrome or pain in the shoulders and the arms down to the fingertips, because they're very common things and they all relate back to a similar part of the body. Okay, and so I'm going to talk to you about that today and really help you understand what's causing it. And that's the key to really getting better too. You know, I have patients that come in all the time that are with these symptoms that are loading up on over-the-counter medications, or worse, major neurological medications from the neurologist. They've had CAT scans, they've had MRIs, X-rays, all these different tests, and they still have pain. Some of them had surgeries and they still have pain. And so I want to help you find the root cause of your problem, but then also start to teach you what it's going to take to fix it. Okay, so let's dive into this. So the first thing we're going to talk about is, boom, headaches. So headaches, what causes headaches? What causes migraines in general? And ultimately, the number one cause of migraine headaches or headaches in general is going to be the upper part of your neck. Okay, I'm going to go right to it. 90%, the studies have shown that 90% of migraines are related back to neck problems or go along with having neck problems. And it's because this upper part of your neck is a very vital, very important part of your body. Okay, so I'm going to show you a picture here to give you a good idea of how this works. Okay, so you can see on this picture, you see the top part there, right in this area. You can see all these nerves that come around here. You also have muscles in that area of your spine that attach right here and then attach right here. And these occipital muscles, whenever there isn't good movement in that area or it gets locked up, they can actually spasm, or they will lock up on you and creates knots and trigger points, which causes pain. It can lead to cervicogenic headaches, and then eventually it can lead to migraines as well. So that's the first reason the neck can actually cause headaches. That's one. And then the second reason, when it comes especially to migraines, and I'll show you this on here, is this upper part of your neck right here. The atlas bone, the top bone in your neck, has an artery going right through it. It's called your vertebral artery. You can see that. That feeds the blood supply to your brain. Let me just make sure you got a good picture of this. Right there, cool. So that feeds the blood supply to your brain. You can see that vertebral artery feeds a good blood supply, goes through that top bone in your neck. When this bone isn't moving properly, or it's out of alignment, or it rotates, ultimately what happens is it can cause spasming to that artery. It can also affect the musculature around here, which will cause arterial issues. And also the hormones, our hormones are controlled in the brainstem, which is right up in here. So upper cervical issues almost always are related back to migraines. You don't need a CAT scan for that. Actually, I'm going to give you an interesting statistic that 1 out of 11,000 CAT scans actually shows up with a tumor. But it's the number one thing they do to check when you come in with a migraine. They're not actually supposed to do that unless you have a lot of other symptoms with it, but it's the number one thing they do. So CAT scans, tons of radiation, not necessary. If you have a migraine issue, it's probably the upper part of your neck. The way to tell if it's the upper part of your neck is we take x-rays. Most people with migraines have lost this curve. Okay, so instead of being curved like this where the spinal cord is nice and relaxed and everything's working properly, they've lost this curve in the neck from computer sitting, from being on cell phones all the time, from car accidents, injuries, falls, all this other kinds of stuff. Athletes like soccer players, major issue with that. And so it can be that. It can also be that this top bone in the neck actually shifts out of alignment. And that one major thing that many migraine sufferers have in common is they sleep on their stomach. So all night, like this, head turned, twisting that area of the spine. It all goes hand in hand. So what we do to help with migraine headaches is we adjust the upper part of the neck, and then we start to retrain the body, or teach the body to retrain itself to get you from here with this lost curve in the neck and forward head posture back to here, and that makes sure it stays there long term. I can tell you story after story from patients in our office who come in with migraines and that don't have them anymore. Mel is one of my favorite stories. She was dealing with them regularly, literally every day, to the point where she would have extreme migraines, and to the point she was actually throwing up. She came into our clinic and started getting care, started getting her spine adjusted. She had upper cervical issues, started getting her spine adjusted, and migraines slowly started to shift away. It went from every day to once a week to every other week to way less often. And this point, this year, I think she said one this year. Last year, she said she didn't have any migraines the whole year. Pretty cool, right? And it's because we got pressure off the nervous system, the body was able to heal itself, but we got to the root cause. No medications. These medications for this stuff is hardcore. If you're taking a medication for a migraine or headaches at all, ibuprofen, Aleve, all those things, get this, NSAIDs, non-steroidal anti-inflammatories, which are ibuprofen, Aleve. This last year, the FDA came out, Food and Drug Administration came out and said that the studies show that it increases your chance of a heart attack 20% within the month that you take it. That's big, no joke, big deal, okay? So migraine. So the next one I was gonna talk about is neck pain, okay? So we got neck pain here, and I'm not sure why I'm using these cards, trying to be creative here, right? So neck pain. So we got neck pain, and how does this relate to headaches? Well, obviously neck pain is gonna stem from your neck. And if you look at the neck, I'll show you this picture again. These are just some of the nerves that come out of the neck. These are the nerves where you actually have feeling. So you can see all of this right here. That comes down into the hands all the way down to the fingertips, which we'll talk about with carpal tunnel. But that lower part of your neck, head or neck pain could be anywhere in between. And ultimately what happens is when you lose the curve in your neck or one of those vertebrae isn't moving properly, it creates a stress response in the body. Let me just show you what I mean by this. Okay? So if you take your neck and it has a curve, good healthy curve in it and all these joints are moving, you're not gonna have neck pain. At least chronically. You might have a soreness here and there from something you did that day. But chronically, you're not going to get neck pain. What happens is we go through life, we have car accidents, injuries, falls, we sit at computers all day long, we sleep with our head turned like this all night long, and our neck birthing process really hard on the spine, and our neck slowly does this. Okay, now you come in, you've lost the curve in your neck. Well, you have discs in here, and those discs start to get more pressure. Now the weight distribution that was evenly going throughout your spine, now it all goes into here. The most common disc herniation area in the neck is going to be right here in the lower part of the neck because of this. All the way to the head goes right here. Eventually that disc, which is just fluid, herniates through the ligaments over time, and it breaks down and causes a disc herniation. So you can cause pain. You see all those little nerves coming out. Those go to the muscles in your neck. Those go down your arms into the shoulders. That shoulder tension typically means you have forward head posture and a loss of curve in the neck. But you can actually just have a bone in your neck that doesn't move. It locks in place. And when it locks in place, it creates stress in the joint. That stress in the joint creates inflammation, which in return can cause pain. Okay? And not just that, that's just pain. I'm just talking about pain there. What it also does is it creates stress in the entire body. And our body sees stress the same way, whether it's physical, whether it's chemical, whether it's emotional. So down the road, typically what we'll see with people with neck pain or people that have neck problems is you'll see other health issues stemming from it. You can see things like thyroid issues because the middle part of the neck goes to the thyroid. You can see things like facial issues, headaches, sinus problems right here in the second bone in the neck. It goes all to your sinuses, right? You can see this little diagram here on the head. See all that neurology through there. All that stuff's controlled by the nervous system, okay? So you have all those nerves stemming out to here. You have the lower part of the neck and the upper back, which actually goes to your heart and to your lungs. They've shown that forward head posture leads to heart and lung problems. The middle upper part of your back goes to the nerves to your stomach, specifically the esophageal gastric sphincter, which is gastric esophageal sphincter, which is what's supposed to close to keep you from having acid coming back up, which we call GERD or acid reflux issues. So many times middle back issues will cause acid reflux. Lower back or middle back issues can also cause things like kidney problems or adrenal issues. Lower back is going to be lower digestive system, also back pain, and then your lower part of your spine all the way goes down your legs to male and female organs. We've had issues with people coming with menstrual cycle issues, all kinds of stuff that works. And you can just see on this poster, I'll show you one more time. But you can just see, look at that neurology. And that's just what you feel. This isn't even the autonomic nervous system that I could show you where you have, everything else. These are just the spinal nerves that control the muscles. Right? That's not even the organ nerves. You have so much more than that. And only 9% of the nerves in your body are actually for pain. Okay, so when it comes to neck pain, the number one thing you can do to find the root cause of your neck pain, number one thing, is to actually see what your spine looks like. So what we do when we go through a consult with someone that comes with neck pain, here's exactly the process we go through. We go through questions, we want to try to figure out what led to it. So if they're sitting at a computer all the time, I've had patients that come in 7 to 8 hours a day, they're at a computer 5 days a week. Over 5, 10, 15 years, probably what caused your neck pain. Or they had a major car accident 5 to 10 years ago. Or they sleep in their stomach all night long. Whatever it is, sports injury. So we have these accents. We want to find out what's causing it. The second thing we want to do is evaluate how your body is moving. Okay, or I'm sorry, the second thing we're gonna do is look at your posture. So I'll have you stand like this, and if your head's like this, you have forward head posture. There you go, there's your neck problem. If you come here and your head's like this, your head's tilted, you have a neck problem. We can tell you from your posture, it's a window to your spine. The third thing that we're gonna do is range of motion. So when you turn your neck, so watch this, when you turn, you should get all the way chin to shoulder. All the way chin to shoulder. If you can't get all the way chin to shoulder, that means there's restriction and there's something happening in your neck. All the way down, all the way up, no pain, should go all the way back. One ear to one shoulder. So full range of motion is what you want, and that's what we're checking for. The next step is we're actually gonna feel your spine. So I'll get in there and feel this musculature. We can tell, and you can feel it yourself. When you just feel your neck, if there's more tension on one side than the other, maybe more inflamed, or you can actually feel things kind of sticking out, or tenderness, that's a good sign that your spine is subluxated, which means that joint is locked in place, creating a nervous system, a stress response. It can cause pain, but it doesn't always cause pain. But if you're having neck pain, the key indicator, number one, pain is a symptom in and of itself telling you there's a neck problem, but also just feeling. You can tell where that problem's coming from by feeling your neck. So we'll go in and feel and see what kind of range of motion you have. The final thing we do is we take x-rays. We take one from the front. We have you open your mouth like that when we take this x-ray so you can see the top bone in your neck perfectly. That's the one that artery goes through. We do an x-ray from the side so you can see the curve in your neck. We also do one like this and one like this so we can tell what bones in your spine are moving and what aren't moving, which will lead us to the problem. It's very simple. And that in and of itself will tell us if you have disc degeneration, arthritis, degenerative disc disease, any of those things, it'll give us an idea of what's causing your neck pain. The next step is then you can walk you through how to fix it. But you gotta find the cause first. Ibuprofen, Aleve, different medications for it, not the answer. Surgery, not the answer. Horrible success rate with surgery. I can't believe they even do it anymore. They're not supposed to be really doing fusion surgeries unless there's an instability issue, but they do it all the time just for different disc problems, okay? So, neck pain. Carpal tunnel syndrome is the next one. I want to mix that together with just the tension into the shoulders, down into the arms, numbness tingling into the hands. Specifically, carpal tunnel is right here, okay? And it goes to these fingers right here. Half of this one and all these over here. That's your carpal tunnel. It's your radial nerve. Goes right through here and affects here. Okay, now if you have full arm and hand numbness, it's more than just the carpal tunnel. But what they've told us is that builds up with scar tissue from typing too much or using your hands too much, and it causes numbness, tingling in the hands. Here's the truth, though. That can happen. It's just rare. Think about it. We're meant to use our hands. What we're not meant to do is sit at a computer all day long like this. And all that weight of your head is going right here, right? So you're all the weight of your head going right into the neurology, right there, into those nerves, okay, that come down your hand, right to those fingertips, all the way down, right? So you got that nerve right there. And what happens is you get the weight of the head going in here for too long. It builds inflammation, it builds stress. You start having irritation to the nerves. First, it starts out with a little bit of shoulder tension. Sometimes it can actually start here and work its way up. Many times, though, most of the time it'll start here, work its way into here. You find yourself waking up at night with numbness, tingling, arm falling asleep. That's a telltale sign that you have issues in the lower part of your neck. It doesn't mean you have to have neck pain. Plenty of patients that don't have neck pain, that their arm issue is coming from their neck, okay? If you have shoulder problems, many times that's coming from the nerves in your neck not being able to heal your shoulder properly. That's how it works. So carpal tunnel syndrome, before you ever consider cutting into the wrist and starting to do all kinds of issues there, let's check the lower part of your neck. I have an amazing story of a friend now, but a patient named Tamara came in, it was about 6 years ago. I met her at a health screening. It was on a health fair, and I was talking to her, and she was about to actually have a surgery where they were gonna, because she would have numbness tingling into the arms, they were gonna do a surgery. They did a nerve scan. They said she didn't have nerve problems, but she was having numbness tingling into the arms. So they said, we're gonna do a surgery. They thought it was an arterial issue, and they were gonna take the subclavian artery and put a stent in it. And they thought that was gonna be what's gonna get rid of her problem. Okay, well, whatever. So didn't make a lot of sense to me. I told her, hey, give me a month to work with you. Let's take some x-rays. She had no curve in her neck. I said, give me a month to just help introduce this curve back into your neck, get your spine moving again. And I really think we can see change. She let me do it. We took that month. Within 2 weeks, her numbness, tingling, and her arms were gone. It's been 6 years now, no surgery, no numbness, tingling. She does full all-out, 9 rounds sporting training all the time. She does all kinds of stuff, planks, everything she couldn't even think about doing before, but she never had to have the surgery, and that's the key. That's a major surgery. So always question, always wonder, is this really the thing I need to do, especially when it comes to surgeries or when it comes to taking a medication? The last final thing I'll tell you never to do and do your best to stay away from is cortisone shots. Those things will deteriorate the muscles and the tissues around it. Research it. It also will cause more issues down the road. Might help in the moment, but it is making your body worse in the long run and will eventually lead to a major tear in the shoulder, knees, anywhere you do it. It's going to lead to a tear down the road. So you want to stay away from that. All right, guys, that's headaches, that's neck pain, that's carpal tunnel syndrome. I hope you got a lot out of this. Hey, go to queencityhealthcenter.com. If anything I said clicked with you and you want our help, simply just go there, schedule an appointment time. You'll sit down with myself or my wife, Dr. Holly, one of our doctors or team members, and we'll spend that time to really work with you and figure out what's causing those health problems. If you're dealing with any of the things I talked about today, you got to come in. That's it. So schedule that time. We have an office in South Park, one in Matthews. If you watching this video, you don't live in Charlotte, in the Charlotte area, send us an email. We have a huge network of doctors all over the country. We'd be happy to get you set up with someone there where you live to help you, actually figure out what's causing the problem. No more ibuprofens, no more leaves, no more medications. Let's find the root cause of the problem. All right, Dr. Kyle Lovis here. You guys have an awesome day, and we'll talk to you again.